Tonight and new at 6, more hospital consolidation. Yale New Haven Health wants to buy 3 Connecticut hospitals.
And reaction to this growing trend is a little mixed tonight. Chief political reporter Susan Raff is joining us live right now with more on the specifics of the proposal. Susan?
Mark, if Yale New Haven Health gets its way, it could take over Manchester Memorial Hospital and 2 others. It's not a done deal yet, but it does raise many questions about quality and access to care. Yale New Haven Health, which owns Yale New Haven Hospital, is the latest to join the trend of getting even bigger. An agreement has been signed to take over 3 Connecticut hospitals: Manchester Memorial, Waterbury Hospital, and Rockville General in Vernon. The plan also includes Prospect Provider Group of Connecticut and the Visiting Nurse and Health Services of Connecticut. The CEO and president of Yale New Haven Health says now more than ever, it's critical for us to find ways to creatively sustain local access to high-quality care.
It's a business deal, and with any business deal, there are upsides and downsides, and we're not producing widgets, or we're taking care of real people.
Angela Maddie teaches healthcare-related courses at Quinnipiac University. She says these deals must be evaluated not only to determine if they are cost-effective, but will they provide high-quality, good, safe care. Hospital acquisitions have become a reality. Hartford Healthcare has taken over hospitals throughout Connecticut. But State Senator Matt Lesser, who chairs the legislature's Insurance and Real Estate Committee, does not support these acquisitions. He says healthcare monopolies are simply not in the public interest. They raise prices for consumers and limit access.
Right now, there's a need for lots of improvement in the system. We spend almost 20% of our gross domestic product on healthcare, yet we still have significant patient safety issues.
This is a growing trend, and some say it is reality. But in this case, with Yale New Haven Health, it is not a done deal yet. This agreement is still subject to regulatory approval, and we are told that it could take several months for a final decision. Live in the newsroom, Susan Raff, Channel 3 Eyewitness News.